Ready? Okay. So since we have, as I have mentioned before, the skin today. I go for tendon. I like to use a mnemonic of a stand, skin, tendon, nerves, deformities, the arteries and deformities. So when we go the common flexor origin, before doing anything in the hand, it's important to know the the anatomy. The anatomy will give us a lot of things and understanding to the pathology that's involved with the hand. So when it comes to the common flexor origin, it will have four muscles: the pronator teres, the flexor carpi radialis, the palmaris longus, and the flexor carpi ulnaris. Each muscle is supplied, all of these muscles are supplied by the median nerve, except the FCU is supplied by the ulnar nerve. Just to note, all the muscles of the hand are supplied by the median nerve, except the ulnar sided one. Then you go deeper to the muscles, that is the flexor digitorum superficialis, profundus, and the flexor pollicis longus. All of them are supplied by the median nerve. So when it comes to the muscles of the hand, I have mentioned that the extrinsic muscle, they have their origin from the forearm and they get inserted into the hand. When it comes to the muscles of the hand and the intrinsic muscles, their origin and insertion is in the hand. You have the thinner muscles, the opponus pollicis, the flexor digitorum, the flexor superficialis, superficial head and deep head, and you have the adductor muscles. You have three hypothenar muscles, and you have introsseous and lumbricals. The introsseous and the lumbricals, they are the only muscle that originate and insert into a tendon, and they are responsible for the flexion of the MCP joint. So they are responsible for the flexion MCP joint and extension of the DIP joint. To that limit, you can do it that way. And then once you go here, you have to flex each finger. Do for me the tugging grip. That's the tugging grip. So the tugging grip is that way. No, that one. Okay, that one. Okay. So you can ask the patient to do that one. Okay. And you can ask the patient to isolate each finger and to flex the PIP joint to make sure of the functioning of the FDS. Flexion extension, the pad of the introsseous muscle, flexion extension of the thumb, which go to evaluate the thumb, adduction